Hi, Dr. Corey here, and today's Thyroid Success Secret is going to be number 16. We're going to talk about PCOS, or Polycystic Ovarian Syndrome. There have been many studies that show PCOS, or Polycystic Ovarian Syndrome, can trigger Hashimoto's disease. PCOS is a common female hormone disorder. It affects 5 to 10% of menstruating women, and it's one of the most common causes of infertility throughout the United States. Pico symptoms include the inability to lose weight, hair loss, fatigue after meals, hormone imbalances, and sugar cravings. Do these symptoms sound familiar to you? Do they sound like a thyroid patient maybe? Well, they do. Blood chemistry tests are something that we need to make sure that we do properly. We need to make sure that we evaluate you thoroughly with. PCOS can be identified by insulin resistance. Again, insulin resistance, going back to that blood success secret that I gave you, blood glucose level from 100 to 126. Now, that's a fasting blood glucose level. That would give you insulin resistance. So the definition of insulin resistance, once again, is 100 to 126 on your blood glucose level. You are insulin resistant. It's also indicated with elevated triglycerides and cholesterol, especially the triglycerides are actually higher than the cholesterol levels on your blood test. Now, insulin resistance, which is a condition in which the body's cells become resistant to the insulin due to the high carbohydrate diet, this leads to excess testosterone production, and this leads to polycystic ovarian syndrome. So you see how the wheel turns. Everything gets a little bit deeper with each one of these success secrets. We want to delve into, find out exactly why you're having a problem. As testosterone levels rise, the cells become further and further resistant to the insulin. This in turn promotes testosterone elevations, which creates or slows down your whole process of how your body functions hormonally, and this is just a slow declining downward spiral as far as from your health standpoint. Insulin resistance also promotes increased inflammation and immune system problems, which predisposes each person to autoimmune disease even further. You factor in all this with Hashimoto's, and now you can see why it's important to address Polycystic Ovarian Syndrome, or PCOS, when addressing your thyroid conditions. Don't suffer another minute, another day, or another year. Call our office at 714-730-5833. I'm Dr. Michael Corey, and I sincerely hope to help you overcome your thyroid dysfunction. Call today. Space is limited.